strengthen Native communities through advocacy, promoting equity and cultural responsiveness. Introduction of my presentation. Native American communities have demonstrated remarkable resilience despite generations of historical oppression and social inequity. However, many indigenous populations continue to encounter barriers related to healthcare, behavioral health service, education, and social support. Historical context and ongoing inequity. The legacy of marginalization. Native communities have experienced centuries of systemic injustice, including forced displacement from ancestral land, violation of tribal sovereignty, policies influencing Native communities, local level, state level, federal level, advocacy initiative, expanding access to cultural responsive mental health care. Behavioral health concerns remain significant within many Native communities. Yes, access to cultural appropriate service is often limited. Primary objective: increase funding for tribal behavioral health programs, expand access to community-based mental health service, promote workforce development for indigenous providers. Advocacy strategy. To advocate these goals, the following activities were proposed: community partnership, legislative advocacy, public awareness. Public awareness campaign purpose: increase public understanding of Native mental health concern while promoting culturally rooted pathway to healing. Platform: Facebook, Instagram, TikTok, Twitter. Community survey development. Why conduct a survey? Community input is essential for ensuring advocacy reflects the priorities of those directly affected. Survey objective: perceptions of mental health service, barriers to care, preference for healing approach. Sample survey question. Participants were asked questions such as: how accessible are mental health services within your community? What barriers make it difficult to seek support? Survey implementation plan. Distribution methods. Paper survey at tribal events, community health clinic. Community collaboration. Work alongside tribal representatives, utilize community health workers. Major concern: limited access to Native behavioral health provider, services lacking cultural understanding, community preference. Greater integration of traditional healing, inclusion of elders in wellness initiative. Evaluation advocacy outcome. Formative evaluation. Conducts throughout implementation by seeking community feedback, monitoring campaign engagement, meeting regular with stakeholders. Indicators of success: increased participation, improved awareness, stronger community partnership. Summative evaluation and impacts. Assessing long-term outcome. Evaluation focused on what advocacy effort results in. increase visibility of Native mental health concern, policy discussion related to service improvement, greater community engagement. Lesson learned and barriers. Lesson learned. Trust building requires consistency and patience. Community members should guide advocacy priorities. Barriers encountered. Limited internet connectivity, geographic isolation, historical mistrust of outside system. Conclusion. Native American communities possess tremendous strength, resilience, and cultural wisdom. However, historical injustice and ongoing inequality continue to affect access to behavioral health service and overall well-being. Social workers have an ethical responsibility to advocate alongside indigenous community by supporting tribal self-determination, promoting cultural responsive service. Thank you so much for listening.